Leg edema. Introduction. Edema results from small blood vessels that leak fluid into surrounding tissue. Select true or false. Correct. Which one of the following is not a sign of leg edema? Choose one of the following options. 1. Leg swelling. 2. Skin that bounces back quickly after being pressed. 3. Skin that is shiny or stretched tight. 4. Ulcers on the legs. Correct. Skin that bounces back quickly after being pressed is not a sign of leg edema. If a person has leg edema, the skin will remain dimpled or pitted after being pressed. Which one of the following may cause leg edema? Choose one of the following options. 1. Certain medications that affect the heart. 2. Certain medical conditions that affect the heart, kidneys, or liver. 3. Pregnancy. 4. All of the above. Correct. There are many possible causes of leg edema. Treatment for edema may include which one of the following? Choose one of the following options. 1. Diuretics. 2. Support stockings. 3. Treating the underlying medical condition. 4. All of the above. Correct. You can also help leg edema go away. Elevate your legs higher than your heart while sitting, and avoid sitting or standing in one position for too long. Edema caused by heart failure usually disappears on its own. Select true or false. Correct. It is necessary to treat heart failure to help reduce the edema. Thank you for using Explain.